Hello everyone and thanks for watching today's video. Today I'm going to talk about a few countries which I have picked around the world to see which countries did better than others during this pandemic of COVID-19. So the first country I'm going to talk about is China, which are responsible for the start of this pandemic. Still till date, they have not come up with the explanation how and when it started. Now, one thing the West was very critical about China, which I think Chinese did very, very well in Wuhan, was a very hard lockdown. Now, we called it like martial law over here. However, I think that is the thing which was mainly responsible for keeping the death rate very low. They use their resources very well. Only country in the world that I know that who have built um, COVID-19 dedicated hospitals from scratch within a week of this epidemic starting. They went into lockdown quite early. I think it was 23rd of January. They went into lockdown. However, they were the ones who set precedents towards lockdown. Otherwise, I think most of the world would still be thinking that how do we get rid of this virus, or how do we reduce the peak of this virus without going into lockdown. Yes, there's a question mark about their death rates because the death rates were 3,400 and something. And just in Wuhan, they doubled the death rate. Still, the total death rate is just over 4,000. And I think their death rates that they have put forward to WHO, I presume they have been checked by WHO, are not incorrect. The reason I say that is because most of the countries that are reporting the death rates at the moment, whether it's United Kingdom, USA, Italy, Spain, France, or whichever country in the world, the death rates are going to go up in all those countries when these countries come out of lockdown, because the deaths that are happening at home in the community are not completely recorded at the moment. So I think every country's death rates are going to go up. So I'm not, I think Chinese death rates, what they've reported is correct. Next country I'm going to talk about is South Korea. In my view, this was the most prepared country in the world for this pandemic or any pandemic. They took it as a war and they were ready for the war. And the reason is because, as you know, that few years ago, they had MERS, which came into Korea from somebody flew from Bahrain into Korea and took MERS with them. And they learned lessons from that, and they had the infrastructure which was ready and was ready to go from day one. And as soon as they started seeing patients of COVID-19 in Korea, they had the best testing that was going on at the time. And even now, I think they were testing so many patients. They were they're isolating the infected very early, and the contact tracing was incredible. And all that because they use the technology of smartphones and the infrastructure, the GPS and all those things, which were the way they used it, is just absolutely phenomenal. And I think that was the country that the most of the world, or the rest of the world, should learn how to go forwards. God forbid if any other pandemic happens, which I think will happen in the future, the way things are going at the moment. So I think that is the country to learn. Next part of the world I'm going to talk about is Americas. Now, when I talk about America and I talk about Europe, the only way I can judge which country did better than others or coped with this condition better than others is to look at the death rate. And that is the only way, because populations are different, the resources are different. So if we put all that into one pot, see from the population point of view, from economics point of view, from the resources availability point of view, which country did best, and that is how we are going to go from now on in this video. So two parts: America, North America, South America. Obviously North America, USA and Canada. Canada, it has affected, but the population is very small. So as compared to USA, Canadian hasn't done as badly. USA, I think, obviously, they have done, well, death rate, I think, was 42,000 yesterday or this morning. and that was higher than anyone anywhere else in the whole world. And the reason I think is um, because of first few weeks they were in denial that nothing will happen, nothing will go there, nothing will happen there, it will not escalate, we can deal with it. And obviously it went out of hand. Testing was nowhere close. Lockdown came very late, and also their contact isolation, etc., was non-existent. So I think that was, I don't know how American health system works, but so I'm not going to comment any further about it. South America, as compared to North America, despite having some countries and some cities with huge population, very few resources, have done reasonably well from the death rate point of view. And the reason is, I think, because their lockdown was hard. They did not have resources to put into the health service like Europe and North America had, but whatever resources they had, they focused on one thing, which was lockdown, and did it very, very well. And I think that's the reason why South America has got a low death rate. From America, we come to Europe, and the first country I'm going to talk about is Germany. Germany is the country which I think did best in Western Europe. I don't say that, everyone will say that. And I think the reason is because they knew their strengths, they had a definite strategy, they did not follow anyone else's strategy. They came up with their strategy according to their strengths, and their strengths was primary care, their strengths was secondary care. So their general practitioner or family practice base is very, very strong. And also their hospital base, with the technology they have, the intensive care beds available, the ventilated beds available, and they increased the capacity, obviously. They went into testing very early. They have probably tested more people than the whole of Europe put together. So they are, and I think that's why their death rate is so low. Still early days to see whether when they start coming out of lockdown, what will happen. But I think once the trajectory of the curve is not going this way, but going slowly and smoothly, those countries are doing very well. Now I'm going to put three countries together: Italy, Spain, and France. Italy was caught totally unprepared. The first country that went into lockdown in Europe, I think it was 9th of March when it went into lockdown, 2 weeks after Wuhan. The disease came into northern Italy in Milan, and I think it spread like wildfire. Neither the health system was ready, neither the technology was ready, neither the ventilated beds were ready. However, learning from Italy, other countries maybe were slightly more ready as compared to Italy. They got their ventilators ready, etc. However, again, these two countries did not do very well because they did not have any preparation ready. Their lockdown was a bit soft to start off with before it became harder when they realized that how bad this disease is and how fast it's growing. So obviously these countries that's why I have the highest death rate in Europe at the moment. Now I'm going to focus on United Kingdom. I live in United Kingdom. I worked in the National Health Service, the NHS, for 29 years now. And I love the National Health Service. United Kingdom put out a document on the 3rd of March about the strategy they had to contain the disease and to fight COVID-19. And the word that was written in that document that I remember top of my head was that we are very well prepared to fight this disease because we have our experience and we have learned from previous pandemics of influenza, etc. So we have everything in place. On the 10th of March, as I remember, there were 6 deaths in the United Kingdom from COVID-19. 6 weeks later, today, which is 21st of April, there are almost 16,000 deaths. So if we turn the clock back after the 3rd of March, just as UK went into lockdown, I think it was 23rd of March, 20 days later, it was very obvious that the people who are making decisions about how to manage this condition, which are the medical experts and the people in the government who they were guiding, um, had only one strategy. And that strategy was no strategy of their own. They were just following what was happening around Europe, especially the Western Europe, Italy, Spain, and France. They could not follow Germany because Germany were so aggressive about their testing that UK, not even now, 6 weeks later, when Germans started their testing, are even close to what they were 4 or 5 weeks ago. So UK just could not follow German lead. So they had to follow something they knew was happening. I think at this stage they had already accepted that whatever strategy they had, if they had any, had failed, because the first part of the strategy was containment, and the containment never happened, and the disease was rampant throughout London area and outside London area very soon after it started. However, I do accept that these are unprecedented circumstances, and coming up with a strategy which people have never seen or never heard a condition, the way it's spreading is unusual, is very difficult. However, you need to have a plan of action. You need to have the right people in the right place to make those plans of action. People who understand about epidemics, people who understand about pandemics, people who will be actually involved with the management of these patients when they come into the hospital. So people who are intensivists, people who are going to look after respiratory problems, they have to be on the board of the top people who are sitting up there and making those decisions of how this pandemic is going to be managed. And I think certainly in the first few weeks, lots of criticism about it in this country, and the criticism was correctly directed towards them, because the people who were making decisions were perhaps not the right people. If they were the right people, they were not the right skill mix. If they were the right skill mix, then they were totally indecisive about what their next plan of action is going to be. We were very lucky in this country that we had a 2-month head start. So we knew later part of January that the disease has come into Europe, and how China and South Korea are already dealing with the disease. So we had examples in front of us. We knew the disease is here. We knew how rapidly it's going to spread, because we already knew how rapidly it was spreading in China and South Korea, etc. However, even 2 months later, when UK went into lockdown on the 23rd of March, we failed on every level. We failed on testing. Our testing is so minimum. I had a letter for testing myself for where I work. If somebody has got COVID-19 symptoms, if somebody is in contact with COVID-19, or somebody at home is in contact with COVID-19 patient, to send them for testing. We are in the 5th week of lockdown, and I got that email from Care Quality Commission day before yesterday. That's how far behind we are. And the nearest center that is being recommended is about 40-mile drive from here. And I don't drive. So me trying to get there on a train, services are far and few, how difficult it will be for me or somebody like me. Next thing, isolation. They failed on isolation. And I'll talk about one simple thing. There are lots of vulnerable people around, like in every country. We have lots of highly vulnerable people who are supposed not to be in contact with other people. These people who have got underlying severe medical problems, they got immune problems, they had post-cancer treatment, etc. So the immune system is very poor. They got severe breathing problems in the past. So NHS sends out isolation letters to these people, and it's an automated generated NHS letter. Still, 10,000 people are waiting to receive their letters, and we are 5th week on the lockdown. These letters they should have received about 8 or 9 weeks ago. And what about our lockdown? Our lockdown is a strange lockdown. I went to work yesterday because I work in a medical sector. So I went to work yesterday, and you can see cars outside, you can see people outside, etc., etc. And uh, local councils are fighting the federal government that they want to keep the parks open. You know, they want to reduce the footfall in the parks. They want to keep it open because it's healthy for people to go out and have a walk. Now, there are countries who are in such hard lockdown that people are not supposed to leave the house. In France, if you leave the house, you have to fill out an online application form to tell why are you leaving the house. And if you don't meet certain criteria, you are fined so many euros online. So this is a European country. That's how hard the lockdown is. And in some countries, like in Southeast Asia, in the Middle East, Eastern Europe, the lockdown is extremely hard, and people really look after it. Here, we say no, we can go out for a walk in a park. Yeah, many of us can argue it's a good thing. A park which takes 10,000 people a day, if we reduce the footfall by 10 times, say 1,000 people a day, then they have got fair distance between them. And what is wrong with that? We are trying to contain the disease here. So for example, somebody walks, most people will walk on a path in a park. Yeah, they don't walk on the grass. Usually they walk on a path. So one person is walking on the path. This person is carrying COVID-19, doesn't know about it, has a sneeze or a cough, walks off, and 50 meters behind, fair bit of social isolation, fair bit of distance between the two, the person coming behind, who is 50 meters, 100 meters behind, walk past the same area of the path a minute or two later. Aerosol is still in the air from the sneeze or a cough from a COVID-19 patient. The second person inhales those aerosol, goes home, gives to 10 more people or 5 more people in the house. Each person gives to 46 people over the time of 30 days. That's how rampant this disease is. Second example, a person sits on a bench relaxing. That's what people do in a park, carrying COVID-19, not knowing about it. So gets up after 15-20 minutes of resting on the bench, goes home, have a nice day, fresh air, etc. On that day, half an hour apart or whatever time apart, other people sit on that bench. We know the virus can survive on hard surfaces for several hours, if not for a day or two. And if 10 people sit on that bench, but now 10 people are potential carriers of COVID-19, and they will take it to the household, give it to 4 or 5 more people in the household. You don't see a police car on the road anywhere, any police stopping you, asking you where you're going. I've been to work, God knows how many times since the lockdown has started, because I have to go to work. And not even once a policeman or a camera has taken my photograph or stopped me and asked me, "Sir, where are you going?" And I have to give an explanation where I'm going. I have to show my card that I work for the NHS, etc. But it does not happen in UK. And I'll give you an example. My daughter goes to a university in an Eastern European country. And I spoke to her about 3 weeks before we went into lockdown. And she said, "Oh, I'm sitting in my apartment. We don't go out at all. Nobody is out and about." I said, "Oh, wow, why is that?" I said, "Life is normal here. We are absolutely fine. We got only, few people of COVID-19 over here. How many have you got?" She said, I think she said 8 in the country, 8, total number of 8. And I said, "How many in your city?" She said, "None." But her university was closed. All the shops were closed. All the offices were closed. Everyone was working from home. And she used to go out only once a week to get her groceries. That's it. And she was wearing gloves and a face mask. And this is an Eastern European country. And I was checking their figures just this morning, and they have 46 deaths in the last 8 weeks since I spoke to her. And we have from 6 deaths, we have gone up to 16,000 deaths. So that is the difference between the two countries. I'm not saying one thing helps. I'm not saying testing is the only thing that helps. I'm not saying isolation is the only thing that helps. I'm not saying that contact testing helps necessarily. I'm not saying lockdown on its own help. But all these things together, put together, they all help. We had plenty of time to prepare for this, plenty of time, but we were not ready for it. So this is my last slide on how UK responded to COVID-19. And you will ask me, UK must have done something right. Yeah, I think they've done a few things right. I think they knew that we needed ventilated beds, and lots of companies came forwards who normally don't make ventilators, but they make other engineering things. So they were able to help out making ventilators. Ventilated beds were created. A whole purpose-built area, which is in London, was created with 1,000 beds or ventilated beds. It's good to have more rather than less, and I entirely agree with that. And that was how the top medical hierarchy said it should be, and I entirely agree with that. Now, the next thing that comes to is personal protection equipment, so PPEs that we call, and as most of you know, there is a severe shortage of it. But then again, I'll take you back to the previous slide, which said we had 2 months head start. Yeah, and we knew that they were short of PPEs in Italy 3 weeks before us, or even before that. They were short of PPEs in Spain as well. And we could have focused our efforts not just on the ventilators. This shows the people who were making decisions were not used to making these decisions. They all thought about patients needing ventilators, which is obviously the right thing to do. They never thought about people who will be looking after those patients, who will be looking after those ventilators. What about them? Who is going to protect them from this horrible virus? Are they impermeable to this disease? They are not. If you look at the guidelines, it's a joke. You know, in the last 2 months, guidelines must have changed about 20-25 times. And every time guidelines change, however, you look into these things and you say, hang on, what's going on here? You know, yesterday they were saying you cannot use these masks because they don't give you enough protection. And 2 days later they're saying you can use these masks because it gives you sufficient protection. Either the virus is changing its mind every day. If you look at it, the whole country knows that the guidelines are being changed every day or every other day because of not what is required to protect people, is what is available to protect people. So certain hospitals are reusing their disposable stuff. You know, this is a Western country which with one of the biggest health organization in the world, which sets examples for other health organizations in the world, National Health Service, and we cannot protect our own people. You know, there are health professionals on COVID wards who don't have the right degree of protection from their masks, from the gowns they are wearing, from the headgear they are wearing, from the eye protection they are wearing. But they have no choice but to work. They have no choice because that is a profession they have chosen, and they've chosen to protect their patients. And that's what they're doing. Day and night they're doing that. However, the government could not provide them the right thing. Now, the argument on 10 Downing Street press conference the other day was there was a problem with supply and demand, because demand increased so much that supply wasn't available, and quite a bit of supply comes from China. I was looking at the Daily Telegraph article today. There is a local UK company which has shipped tons and tons of PPEs to Europe because NHS does not buy from that person. There are hundreds of factories, hundreds of suppliers around the country who can move from making other things which need stitching or needs plastic, etc., into making PPEs. They've got the right equipment to do that. They've got the right expertise to do that. But our government or our health hierarchy, they don't want to use them for whatever reason. They rather import. Airplane full of PPEs came from Turkey recently. Probably enough supply to last in the UK for maybe half a day. Local suppliers who are begging for the government to use them to supply PPEs are sending things abroad because our government does not want to use them. And on the television, they say in the press conference last night that why don't they contact the government? And even the Daily Telegraph is saying they're trying to contact the government, they get no response from it. Anyway, so these were my feelings about how our government has responded, United Kingdom has responded to this COVID-19 infection. I must give credit where credit is due. The government has done a lot for providing grants, loans, etc. for businesses to keep them afloat. Obviously, they cannot keep every business afloat in this time and age. However, I think they have given so many grants and so much support for people, for business who are working in businesses, who are employing people to keep their employment safe, that hopefully by the time we come out of it, yes, many businesses will go bust, but hopefully many will survive as well. I wish you all the very best. Stay safe, and I hope to see you in a day or two. Thanks for watching.